Hi, this is Dr. Thuy-Lan Nguyen from Nova Southeastern University. The opioid crisis is a U.S. public health emergency and the most perilous drug crisis ever in the U.S. Deaths from opioid overdoses have quadrupled since 1999. This epidemic kills over 90 people in the U.S. every single day. Pharmaceutical pain relief is an essential clinical tool for physicians, but over 240 million opioid prescriptions are written to Americans every year, so the potential for abuse and addiction is huge. Even though most optometrists don't prescribe opioids, it's a crisis affecting our medical community and our patients. Prescription opioids come in many forms. Some of us are familiar with the common drugs prescribed for pain, such as codeine, morphine, hydrocodone, and oxycodone. But now there are even more powerful synthetic opioids, such as fentanyl, which is available as a drug patch, which is even stronger than heroin. Opioids can cause multiple side effects, such as nausea, vomiting, dizziness, confusion, and sedation. But abuse of opioids can cause an increased sensitivity to pain, more dependence, and potentially leading to respiratory distress and death. Many other prescription drugs also have a high potential for abuse. Medications such as Valium and Xanax are benzodiazepines, which are typically prescribed for acute anxiety and short-term management of stress. We all go through phases of anxiety and we're all stressed. But if used long term, larger doses are needed to achieve therapeutic effects. And if stopped too quickly, they can cause a rebound effect resulting in seizures. And if that hasn't scared you enough, there is a growing concern around non-prescription synthetic drugs also. Synthetic cathinoids, such as Flocka, also known as bath salts, can actually mimic the effect of cocaine. These powerful street drugs can cause psychotropic effects, hallucinations, heart attacks, and seizures. It caused one guy in Miami to eat another man's face off. These street drugs can be marketed as jewelry cleaner or plant fertilizers, and they're sold in common places such as smoke shops, convenience stores, and even local gas stations. As medical professionals, optometrists should be familiar with the common prescription and non-prescription drugs that have a high potential for abuse. We should know how to recognize the signs of abuse and how to report them in order to contribute to the care of our patients. It's a growing epidemic, so it's only a matter of time before this problem affects optometry directly. But by learning and preparing in advance, we can become a part of the solution instead of part of the problem.